Okay, here we are. Welcome to my kitchen table. Everyone is so concerned today about health care, and that's all we hear about on television, and everyone's fighting over it, and people are unhappy, and people are confused, and people are resentful. And so I think we need to just look at this and see what's actually going on here. So here we are at my kitchen table, and I have a few condiments here. And the way I think to look at it is, first of all, let's see who's insured and who's not insured. Okay, so if each of these represents 10% of the American people, we have 10, 20, 30, 40, 50, 60, 70, 80, 90, and we'll put these two together, 95, 100. So, okay, here's all the people in the United States of America, okay? 85% of these people are already insured. So these people are insured 10, 20, 30, 40, 50, 60, 70, 80, and look at this, 85% are already insured. These 15% are not, 10 and 5 are not insured. You know what? When you interview these people and you poll these 85% of Americans who are insured, about 80% of them are happy with their health care. They don't like fighting with their insurance companies. It's really annoying. They wish they could pay less to their insurance companies, but they like their doctors. They like their health care. They're satisfied with their health care. They didn't think it was a crisis. They didn't really want to change it. However, you say to these people in America, do you think everyone should be covered? Everyone should have good health care? And they will say, of course. We're America. We like to take care of everyone. We're a generous nation. We want everyone taken care of. And then you say to them, should anyone go bankrupt over medical expenses? And you're like, of course not. You don't want to see anyone that's heartbreaking lose everything over not having health insurance and not having good coverage. So then we look at these people who are all happy, but they would like to see these people covered also. But if you ask these people who are all insured and mostly happy with their insurance, do you want to give up your choices of your doctors and your hospitals? They'll say, no, I like my doctors. I found some really good doctors. I like them. They know me. I don't want to give them up. So they say, we don't want to do that. We want another way. Well, that's not what's being talked about right now. What's being talked about right now is taking everyone's insurance here so that we can cover those who are not insured, taking their health coverage and changing it for everyone. But wait a minute, let's look at this 15% who are not insured. We're very concerned about them. However, when you look at the 15%, you find that by the time you take out the people who earn over $75,000 who could afford health insurance, and you take out the people who are already eligible for government programs but for some reason have not applied, and you take out the people who are eligible for insurance through their employers, and you take out the illegal immigrants, that takes out 10%. We have actually less than 5% of people represented by this, 5% of people in this country who either through pre-existing conditions or they just cannot afford it, or for whatever reason cannot get health insurance. This is what this is all about. It's not about these people. It's not about these people. It's about this 5%. How are we going to cover this 5%? In order to cover this 5%, do we have to take over the entire healthcare system? Take over a sixth of our economy in this country in order to do that? No. Wait a minute. There are other choices. In order to cover this 5% of people who truly cannot get health insurance, what can we do? We can have tort reform. Tort reform would make a huge difference. Doctors who are polled about this say 25% of their tests are defensive medicine. Estimates by different groups tell us that up to $100 billion a year could be saved with meaningful tort reform. States that have done tort reform, like Texas and a few others, have found that it's very effective. That's how we can cover these people, and do it in incremental steps so that we don't destroy the good medical care that all of these Americans have and want to keep.
And they don't want the government to own 1/6 of the economy and make decisions for them about their health care.
Exactly, exactly. We don't want what's written into both of the health bills is that Congress will decide every year arbitrarily how much will be spent on Medicare and Medicaid, and then an unelected board of appointed officials will decide how that money is to be spent. We don't elect that board. We cannot appeal their decisions. They will make the decisions, and that's it. They will come between this whole system, the way it's being looked at now in the two bills that were passed by the House and the Senate, will come between all of these people and the medical care they have right now. It won't happen right away because the way the bills are written, the taxes start as soon as the president signs the bill. But the major changes in your health care will not start until after the next presidential election. And so we won't have any real complaints other than the higher taxes until after the next presidential election. And then at that point, we will have 10 years that we're talking about. We'll have 10 years of taxes to cover 6 years of health care. And what happens after that? If I could budget my family's budget that way, boy, would things look different. But you know what? Down the road, when we have 10 years of income and we have 6 years of expenses, that's not going to work out in the long run. So if we want to insure these people whom we're all concerned about, let's do it in a smart way. Let's do it with tort reform. Let's do it with portability of insurance. Let's be able to shop for insurance across state lines, and let's have high deductible policies, and let's do this in a smart way and an incremental way so that these Americans don't have to say in 4 or 5 years after the next presidential election, don't have to say, oh gee, if only I had known what was in these bills, boy would I have paid more attention. So come to Mom's table anytime you want further explanation.
And you have a very important audience member.
I do. I do. I have a puggy watching me. He's helping